Hello and welcome to Understandable Psychology with Alex, the channel where psychology and mental health are made understandable for you. Please leave a thumbs up, a comment or subscribe if you enjoy my videos and wish to further support our adventure. Also, I just created an Instagram page where I will post irregular updates on the videos on this channel. You can find the link in the bio or the About Me page of this channel. Today we're going to look at the cognitive behavioral therapy, the gold standard in psychotherapy. Cognitive behavioral therapy, or short CBT, is the current gold standard in psychotherapy. It is one of the most researched type of therapy, and scientific studies underline the effectiveness of CBT in treating mental illnesses. CBT is especially effective with disorders such as addiction, anxiety, depression, personality disorders, eating disorders, amongst many others. One of the main goals of cognitive behavioral therapy is to teach patients to become their own therapists. This is done by teaching how CBT works, what needs to be done to work long term, and what individuals can easily do by themselves without professional aid. In a research paper where 11 studies compared response rates between CBT and other forms of therapy showed the effectiveness of CBT clearly. In 7 of those studies, it was scientifically proven that CBT has a higher response rate than other forms of therapy, and in only 1 study, CBT was less effective than the alternatives. In a separate study published by Cambridge, the long-term effect of CBT was scientifically proven in time spans of over a year after the therapy, making it a lasting instrument for therapy and coping. There are 3 basic core principles when engaging in cognitive behavioral therapy. Firstly, that psychological problems are based on faulty and unhelpful ways of thinking. Secondly, they are based on learned patterns of unhelpful behavior. Thirdly, people suffering from psychological problems can learn to cope with those to live a happier life. Further, there are 3 different types of cognitive behavioral therapy. There is the cognitive therapy, which concentrates on thinking patterns, emotional responses, and behavior. Then there is the dialectical behavioral therapy that deals with thoughts and behavior while implementing strategies such as mindfulness and emotional regulation. Further, the multimodal therapy focuses on 7 specific aspects of psychology in order to support with mental illnesses. These would be behavior, affect, sensation, imagery, cognition, interpersonal factors, and drug or biological considerations. And lastly, the rational emotive behavior therapy, or short REBT, is a practice of actively challenging false and irrational beliefs in the patient's mind to understand and change those thought patterns. The steps taken in cognitive behavioral therapy are all quite similar across the board. It most of the time involves, but does not have to, identifying negative thoughts and thought patterns, learning and practicing new skills, setting achievable goals, problem solving and learning problem solving patterns, and at last, self-monitoring and review. Behavioral patterns are broken up in CBT by directly facing one's fear and confronting them, using role-playing to enact certain social scenarios and train them, as well as learning to relax and calm down from all the stress going on around one. Thank you very much for watching Understandable Psychology with Alex. If you liked the video, please feel free to comment, like, and subscribe to support our adventure in making psychology understandable for everyone.